Our abdominal wall appears to be very tough and so elastic that it expands to accommodate a baby during pregnancy. However, when this wall gets weakened, a defect occurs. Such a defect, when in the form of a localized hole or opening, causes an organ or a tissue to squeeze out. It is then medically known as hernia. 90% of all hernia occurs in men, but women and children also get hernia. This video will give you some basic information about hernias that will help you discuss treatment options with your doctor, including the advantages and disadvantages of the various surgical techniques available. The defect or the weakness in the abdominal wall exists long before the hernia appears, often present at birth. Due to constant stretching of the abdominal muscles and conditions that chronically increase intra-abdominal pressure over the years, hernias are very common. Some of these conditions include a chronic cough like smoker's cough, obesity, pregnancy, straining to lift heavy objects, persistent sneezing like those caused by allergies, and straining to pass stool, weakness in the abdominal fascia caused by previous surgery. At times, hernias can also occur with no specific history. Weakening can occur anywhere in the abdominal wall, and therefore we have different types of hernias. Hernias may be present either with pain at the site or just a visible lump. Sometimes it is a vague feeling resulting from pressure on an organ which has got stuck in the hernia. Fatty tissue usually enters a hernia first, but it may be followed by or accompanied by an organ. This may even lead to organ dysfunction. Each type may present itself differently. Therefore, let us get to know the presentation of some of the types of hernia. Inguinal hernia. Inguinal hernia accounts for 80% of all hernia cases. It is more common in men and occurs in a part of the abdominal wall known as the internal ring. This is a potentially weak part in the groin, left when a male's testicles descend during fetal development. An indirect inguinal hernia results when the defect is in the internal ring. From there, a hernia sac may extend into the scrotum in men, or in women to the outer folds of the vagina. A direct inguinal hernia is less common, presenting near the internal ring instead of within it. In fact, women are more likely to have an indirect inguinal hernia. Inguinal hernias may occur on one side of the groin or both sides at the same or different times, but occur most often on the right side. Epigastric hernia. It occurs above the navel, in the upper middle area of the abdomen. It is more common in men than women. Femoral hernia. It occurs when the bladder or intestine enters the canal just below the groin crease. They are most common in women, especially those who are pregnant or obese. Incisional hernia. In an incisional or ventral hernia, the intestine pushes through the abdominal wall at the site of a previous abdominal surgery. These can develop weeks, months, or even years after the initial surgery. Umbilical hernia. It occurs in the naturally weakened area of the navel. Common in newborns, but it can also occur in men, women, and children at the same time. They are sometimes caused by abdominal pressure due to being overweight, excessive coughing, or pregnancy. In babies, umbilical hernias frequently heal themselves within 4 years. You may know all about hernias, but how do you know that you have one? Let us find out how you can identify a hernia. You may suspect a hernia when there is an obvious swelling beneath the skin of the abdomen or the groin. It may disappear when you lie down and may be tender. A heavy feeling in the abdomen that is sometimes accompanied by constipation or blood in the stool. Discomfort in the abdomen or groin when lifting or bending over. The last but very crucial step is to know when to see the doctor. While it may seem that your hernia is not very serious, especially if you're having no symptoms, it is very important for you to see your doctor and decide on a treatment plan. A hernia will not go on its own. When left untreated, hernias can develop severe, even life-threatening complications. You need to seek medical help when you suspect that you have a hernia, as an accurate diagnosis is needed for further treatment. If the bulge flattens out when you lie down or push against it, you have what is called a reducible hernia. In that case, you're not in immediate danger. If the tissue protruding through the hernia is stuck and never flattens out, you have a non-reducible hernia. This is often painful and prompt medical attention is required. This may also indicate that a part of the intestine is very tightly trapped and the intestine has become blocked. This is called a strangulated hernia. It may be accompanied with symptoms like nausea, vomiting, blood in stool, fever, severe pain, and even shock. They're treated as medical emergencies and immediate surgery will be needed to remove the block and repair the hernia. Physical examination by a doctor is often enough to diagnose a hernia, but when necessary, an ultrasound and/or abdominal X-rays may be ordered to identify bowel obstructions. Unless the hernia is strangulated, hernia repair typically is an elective operation. Only you can decide whether you ought to proceed with the repair. However, you must realize that the hernia is not going to heal by itself. Pain may increase in the area of the hernia, and it will usually increase in size over time. A strangulated intestinal hernia may result in intestinal obstruction, causing the abdomen to swell. At times, it can also lead to infection, gangrene, intestinal perforation, shock, or even death. So what is the treatment for hernias? The standard treatment is conventional hernia repair surgery. Surgery seems to be a fearful thought, but over the years, surgery for hernias have become very simple. So much so that now it is also performed as an outpatient procedure. Today, surgeons are using a variety of techniques to repair hernias. You should be comfortable and talk with your surgeon to determine what type of repair method is appropriate for you. Let us understand them one by one. The tension repair is also known as suture repair. In this type of hernia surgery, general anesthesia is usually administered, following which a small incision will be made over the site of the hernia. The hernia sac containing the bulging intestine is identified. The surgeon pushes the intestine inside the hernia sac back into its proper position behind the muscle wall. The muscle wall is reinforced with stitches. This hernia repair technique is also known as herniorrhaphy. A tension repair is recommended for children or if the hernia is extremely small. This technique has several disadvantages and its use has decreased in recent years. First, the level of discomfort following a tension repair is greater and the recovery period is longer, about 4 to 6 weeks as compared to a tension-free repair. In addition, there is approximately 10 to 15% chance that the hernia will recur. Tension-free repair. The procedure is often performed in an outpatient facility with local anesthesia, and patients can walk away the same day. Tension-free repair techniques utilize a piece of mesh to bridge the hernia defect. They are considered the gold standard of hernia repair by the American College of Surgeons. There are several techniques, including flat mesh repair, the plug and patch repair, laparoscopic repair, and the three-dimensional mesh repair. Depending on the case, any of these methods of repair may be used. A tension-free mesh technique has drastically reduced recurrence rates for all hernias compared to tissue repairs and has made it possible to reconstruct large abdominal defects that were previously irreparable. The repair of abdominal wall defects with mesh implants is one of the most commonly performed general surgical procedures, with over 1 million implants inserted each year in the United States. But implants do have their share of consequences, especially the heavyweight mesh implants. The body generates an intense inflammatory response to these implants. This results in scar plate formation, increased stiffness of the abdominal wall, and shrinkage of the mesh material. There is a need to reduce the density and the weight of the mesh. This will induce less foreign body response, result in improved abdominal wall compliance, cause less contraction or shrinkage of the mesh, and allow better tissue incorporation. Experiments and clinical trials indicate that the lightweight and large porous mesh concept is the safest and the best mesh technique for hernia repair. Let us compare and see the difference between the two types of mesh: heavyweight small pores mesh, and the latest is the lightweight large pores mesh. If we have a look at them externally, we find that the heavyweight mesh is stiff, non-flexible. It is made up of thick polymer fibers. It has a small pore size of less than 1 millimeter. It has a high mechanical and tensile strength of about 100 per centimeter, which according to the law of Laplace is not required. It has a large surface area. It causes a lot of scar tissue formation. Compared to these, lightweight mesh is designed such that it has high elasticity, high flexibility, small polymer fibers, large pore size of more than 1 millimeter. That tensile strength is what is required, about 16 tensile strength per centimeter. The surface area which is in contact with the tissues is much lower. It causes less scar tissue formation. The use of lightweight meshes reduces the number of long-term complications, increases comfort, leading to a better quality of life after hernia repair. Let's ease out your rising tension and quickly go through the preparation for surgery. Prior to scheduled surgery, your doctor may manually press your hernia back into place and advise you to wear a special belt known as a truss, which holds your hernia in place until surgery. He may also suggest some painkillers to reduce your discomfort. Routine tests measuring your complete blood count and electrolyte levels, as well as urine analysis, will be done. In addition, the area for incision may need to be shaved. You may be given a local, spinal, or general anesthesia. In most cases, you will be home the same day of your surgery. You may also receive a prescription for pain medication to take at home if you feel discomfort in the area of your incision. The incision itself will be covered with a bandage or may be covered with Dermabond, topical skin adhesive. You may resume normal eating habits and activities within a few days after surgery. You may even walk around the day after hernia surgery. Depending on your occupation, full recovery from hernia surgery may take anywhere from 1 to 6 weeks. Hernias are usually not treated on emergency basis, but its knowledge is equally important in order to prevent its occurrence if not an emergency. Remember, don't let hernia keep you from leading a normal, active life. While hernias are common, if untreated, they can develop into serious and dangerous complications. Keep in mind that hernias don't get smaller and they don't go away by themselves. Hernia surgery using a lightweight mesh is just a small step you need to take, and soon after surgery you will be back home doing the things you enjoy most.